My name's Gerard Criner. I'm the professor and chair, Department of Thoracic Medicine and Surgery at the Lewis Katz School of Medicine at Temple University in Philadelphia, PA, United States. I think this has been a great meeting this year at the ERS from a number of perspectives. It really offers a very hopeful future for our ability to diagnose and treat patients with COPD and emphysema and lung cancer from a variety of different treatment modalities, diagnostic modalities that heretofore haven't really been explored. For example, one of the growing burdens that we have is from lung cancer with solitary pulmonary nodules. And that's an outgrowth of really the data that's shown that using screening CTs can diagnose lung cancer and improve survival by 25% from the National Lung Cancer Screening Study. But it also gives the problem of having a number of nodules that are being identified in patients and how to diagnose those safely and non-invasively so we can diagnose lung cancer without needlessly exposing patients to the risk of diagnostic procedures. So one of the highlights has been the new platforms that have been the EBN devices that are bronchoscopic or endobronchoscopic navigational devices that can help you to navigate to the lesion. And then the Archimedes system, which is from Bronchus Technologies, to be able to create a transparenchymal nodal access to safely diagnose a biopsy by providing a format of Doppler ultrasound to avoid vasculature while you create your bypass tract, and then to be able to make a diagnosis and enhance your yield compared to conventional EBN systems. And using embedded fluoroscopy allows you to do this safely, so you can avoid the pleura, and you can also make sure that you're in the lesion when you're diagnosing that. That's one aspect, but it offers the potential, once you have this access, to be able to treat these lesions in the future by using a range of modalities, whether it's cryoablation or thermal ablation or radiofrequency ablation, to be able to holy grail of the treatment of lung cancer, or SPN specifically, might be able to diagnose and treat a lesion at the same setting, which would be tremendous for patients. The other therapies, such as endoscopic treatment of emphysematous patients who are hyperinflated with advanced emphysema with a variety of endoscopic tools, whether it's valves or coils, those are important advances for our ability to treat patients with emphysema. Being able to treat patients who have respiratory disease that are impaired with chronic bronchitis, which is a complete unmet need by using cryoablation, may be another modality that really treats an unmet need in a patient group that's not really had any effective therapy for decades. And then I think finally, looking at the patient group with frequent exacerbation and using novel therapies with monoclonal directed therapy for patients with an eosinophilic phenotype who have COPD and show that we can reduce exacerbation rates is really a landmark and sentinel finding, that we can really start to endotype and phenotype our patients with COPD and emphysema and do a better job of treating them. So I think this year's ERS has been very instructive for me, and I think for patients it offers really an optimistic future, and that there's new therapies being rapidly developed that can treat patients with important respiratory diseases. And I think for young respiratory physicians in the EU, it shows that the ERS is a stronghold of really novel information. It's a great platform to meet other people. And I think for my US colleagues, it's really a great opportunity to collaborate with international investigators and see novel approaches that we can globally attack these problems that affect patients throughout the world in a much better way.